Good afternoon, everyone.
Good afternoon.
Good afternoon.
Thank you for your time. Thank you, Bradford, for arranging this beautiful session where it deemed necessary for us to discuss about a very critical point. So let's wait if you
Excuse
are
me, ma'am.
waiting. Yes, yes,
Please
we are
just
waiting
we'll
to.
just wait. Yeah, just we'll wait for five
Yes,
more minutes and then we'll
no
do the
problem.
introduction start.
No problem at all. So let's wait for others to come into the session, okay?
Good evening, everyone, and welcome to today's session hosted by Bradford International Alliance under our Elite Professional Leadership Skillshare series. Today, we explore the reality of healthcare leadership, balancing patient care, profit, and ethics, a topic that reflects the real challenges that shape the modern healthcare today. We're honored to have with us Dr. Chamali, Head of Operations and a visionary healthcare leader with over a decade of experience. She is known for building patient centric, innovative healthcare systems while ensuring a strong ethical and an operational excellence. Over to you, Dr. Chamali.
Thank you so much, Sakshi. Dr. Jamali, thank you so much for being here. We will just wait 5 more minutes and then you can start your session.
Absolutely. Thank you very much, Sakshi. Let's wait for the rest of the people to join so then we can start our session. All right, let's go ahead. Good afternoon, everyone. First of all, thank you very much, Bradford International Alliance, for arranging this meaningful session at a time which is extremely required. And I'm honored to speak to all of you. I know all of you are professionals and leaders in your sectors. So I hope today's session will be a very interactive and informative sessions, which we can share ideas between each other and to grow together. So, with that, keep in mind, till the others join, I will just move to my next slide. Let's keep in mind that all of us are professionals, so we might have diverse perspectives about things. So let's keep our mics mute and be present and engage. The more you interact with me, the better it will be for all of us, so we can learn from each other, as I earlier mentioned. So let's respect each other's diverse perspectives. And if you have any questions in between the webinar, you can raise your hand so we can, answer the questions as we go by. Also, in between the session, we have questions and answers sessions for us to all engage, interact, and find better, clear, and transparent answers. Okay, so let's get started. Today, we are going to talk about a very important topic, which is the reality of healthcare leadership, specifically focused on patient care, profits, ethics at a time of crisis, and how it is affecting our operational excellence. I prefer to say operation excellence without using the word pressure. So, a little bit about today's agenda. I wanted to understand, uh, I wanted you to understand that during today's session, we will be, exploring what is the reality behind healthcare leadership. And right now we are in a mid of crisis where we do not know after 2 weeks whether it's going to be what or what not. Whereas uncertainty has come up as a very big challenge right now, especially for the healthcare leaders, and how to balance this in terms of care, profit, and ethics, and in real world leadership, how to apply what we learn to the practical circumstances, and how important it is to make the right decisions driven by facts rather than emotions or reactions. And these are going to be our takeaways at the end of today's session. So please, as I told you earlier, please be open to ideas and let's interact as much as we can. So now let's move on to the first slide of our lesson. But I don't think so. This is me. I'm Dr. Shamali Hiripitiya. So I learned and I excelled my vision and profession as a healthcare operations leader the hard way, like I believe all of you must have achieved. It was not a hard journey to start, especially as a healthcare leader. That's what truly set us apart from the rest of the industry leaders. But when we go through the challenges, when we understand the strengths, the weaknesses, the opportunities, and the threats, that shapes our future as futuristic and visionary leaders. So this is the best and the only way we can learn, we can explore, and we can apply what we learned in our practical day-to-day operations. Whereas I believe, in my opinion, healthcare leaders are playing a very critical job, not only to manage a hospital or a healthcare facility, but to manage the human factor. At the end of the day, healthcare leaders are directly taking and making decisions for the lives of people, which we can refer to as patients. In other industries, when you refer to them as clients, in our industry, we can refer to them as patients. So this human factor is something very special that we've given the opportunity and the responsibility to do the right thing by. Okay, so let's get into the actual subject. I like to start the session with this visionary, saying, great leaders inspire others to believe in themselves. So, as you and me, we all know there are different types of leadership styles. Some like to call themselves a leader while keep on commanding others to do something or to not to do something. That is a bossy type of leadership, commanding leaders. Then there goes another type of leadership, whereas you are enslaved by your own staff. The teams are putting all the responsibilities on the leaders, so the leader carries the whole burden. But in healthcare, as long as we are capable of inspiring others to believe in themselves, mean that they can become leaders. So in our hierarchies, especially in healthcare setups, we have medical management and non-medical management. Am I correct in saying that? So basically, if the medical management and the administrative team, the non-medical management teams, are synergistically inspiring each other to believe in themselves, the clinical decisions and the operational decisions, this is what creates best health ecosystems. So right now, what we are trying to understand in the first part of webinar is to go through the reality of today's time in terms of healthcare leadership. Okay. Now, just the same idea with the adjacent slide, I would like to emphasize. Here you can see great leaders don't create followers. They create more leaders. What is the takeaway from this saying? Can anybody tell me what does that mean? Like, what idea did you understand by that?
Yeah, I mean, by that, great leaders share his knowledge and he delegates the responsibility and they train the people to become leader. They don't dictate the people and, keeping secret, or they don't share their experience to the community.
100%, Mr. 100%. I totally agree with you. They don't need someone to follow you. A leader should be able to lead with or without physical presence. Am I correct? So to do that, the leader's responsibility is to create more people who have the ability to lead. maybe delegate tasks, as you said, maybe share the exact information, maybe share the exact action points. And the great leaders are to monitor those if such visions are being actioned, right? So in today's healthcare leadership, we have few pain points since we are discussing this more towards crisis situations and more present current today's situation. We have circumstantial uh, scenarios where we have to do decision makings under pressure, managing uncertainty, balancing multiple stakeholders, leading beyond protocols. Do you think the healthcare leadership is being determined by the number of patients or the occupied beds or how many staff you are having in your work scope per day per operational shift or how many cases have been attended? Shall we speak about this? What are your thoughts? So let's take first thing, decision making under pressure. How easy or how difficult is it?
It's always easy, but it is not the effective.
Exactly. The pressure can be due to different reasons, right? The pressure can be due to controllable reasons or non-controllable reasons. Let's say take an example. If it is an influence of the environment, building pressure is a category of non-controllable circumstance. But still, as healthcare leaders, we need to take a call on certain things operationally. Let's say the pressure is just a general factor, whereas it's towards the organizational objective alignment, which always the operations leader, the healthcare leader, should take a full responsibility in addressing that matter. So now let's talk about uncertainty. I mean, in my life, this is the most uncertain time I have ever faced after COVID, right? So living in UAE, even though we are very safe, thanks to the UAE leaders, but still there is an uncertainty because we do not know or we do not understand the political, economical, social agendas between two countries, very big players globally. Still, as healthcare leaders, we need to manage some decisions and drive our teams to achieve the objectives ethically. How about balancing multiple stakeholders? I know this is a very, very, very interesting topic. So, in your organizations, how is it right now? Can anybody tell me what you are going through? Maybe you are a line manager, maybe you are a line supervisor, maybe you are a healthcare manager, maybe you are a deputy manager of any kind of a department, or maybe you are a doctor, you are a nurse. How is the situation in your organizations right now when it comes to this situation, balancing multiple stakeholders? How are the patients' reactions? How are the staff reactions?
See, I am in the oil industry.
Mm-hmm.
Actually, oil industry, it is very straightforward, because there is a certain guidelines and rules are set, so it has to be followed, and some contract is established between the different, you can say, other contract, other company or other organization. But within organization, there is set procedure
Mm-hmm.
and the guidelines which drive the
Businesses.
everybody ownership. And second thing,
Mhm.
procedure is there also to follow.
Okay.
So it's easy to, very crystal clear that 1+1 is equal to 2 in oil industry.
Yes,
But in healthcare, it is, I think it is exactly opposite, because
exactly.
expectation is very high from the, when you are even the small disease or big disease, that you don't know. Maybe small symptom is less, but consequences may be high. You don't know. So in healthcare, I think it will be not easy to manage, like, different stakeholder relatives, or administrative and patient, and as a different specialty. So I don't have answer, but I think I feel it. Yeah.
Yes, thank you, Nilesh. How about you, Jory?
Yeah, hi. Sorry,
Hi.
my name is Giath Amir, but this is my daughter's name. I logged
Okay,
in.
no problem. Sorry for that.
Yeah,
Yes, Mr. Amar.
actually, even in the oil and gas, even in everywhere, all industries has been impacted, and there is uncertainty has been felt everywhere.
Yes,
With regards to the healthcare, yes, we have noticed a significant drop of the patient flow everywhere. While there is a specific, maybe only one specialty has is still increasing the volume, which is the psychiatry department. A lot of people
100%.
got panic attacks. A lot of people got anxiety and depression, where they have found themselves visiting the psychiatrist. Yes, the patient flow has been significantly dropped, and definitely, I believe that all the healthcare companies here have taken an immediate action to balance the and maybe reduce their manpower, not by termination, but maybe they give some leaves to the staff to
Yes.
reduce the leave balance, where it reduce the cost, and end up with somehow minimizing or mitigating the risk of loss month by month.
Perfect. Thank you, Mr. Amar. Thank you very much. It was a great answer. How about you, Mr. Robert?
Yes, hi. Interesting topic. Especially, I'm the deputy director of nursing in a hospital here in Dubai.
Nice
Um,
to meet you, Mr. Robert.
Nice to meet you. And I would say that we are giving the message of business as usual. I think you're correct that some of the volume has dropped.
Mm-hmm.
Um, our sort of shift immediately goes to disaster planning, resilience, thinking forward, supply chain reliability.
Yes.
But above all, it's I'm really concerned at the moment about not so much the welfare of the patients, because we provide excellent care, but it's
Yes.
looking after our staff. I'm a little bit concerned over the short-term strategies of giving unpaid leave and things like that. I don't think that buys in any loyalty.
Mm-hmm.
So that wouldn't is not part of my strategy. We're happy to absorb this little hit in the hope that it will resolve soon. But whilst we have staff coming to work and going the extra mile, with schools being at home,
Yes.
staff are physically present, but mentally sometimes they're not present, because obviously, if the national alert goes off and you're at work and your children are at home, it's
Yes.
difficult to maintain focus.
Yes. 100%. Thank you very much for your input, Mr. Robert. I love this conversation going this way, and I invite all of you to interact as much as possible so we can understand much better about this topic. So, again, back to all points collectively. Balancing multiple stakeholders has been a huge pain point in the industry right now, especially given the fact healthcare industry. I believe Mr. Nilesh has mentioned that oil industry has some, facts and some SOPs in place. You do A and then you do B and then you go to C. So when it comes to healthcare with the crisis situations right now, as Mr. Amar and Mr. Robert rightly explained, we are taking decisions based on different stakeholder interactions. So when I'm talking about balancing multiple stakeholders, patient is our king. But then again, with the crisis situation, patient's mindset have been changed. That's a fact, right? They do not want to spend on any health or wellness situations, whereas they are thinking whether there will be a tomorrow for me to be healthy. This is the mindset that we are being researched and we have been acquired in terms of feedback. Next is the internal stakeholders, the staffs who are showing up on a daily basis despite everything, are they being valued? Are they being appreciated? As Mr. Robert said, I agree with you. Right now, it's a very circumstantial issue, but the organizations, especially healthcare organizations and facilities, did run with this task force. So, is this the right time for us to assess that, okay, I will get rid of my task force? Or is there a strategic way to maintain the relationship and balance their emotions as well? Because right now it's more towards emotional imbalance, as you rightly said, whereas people are super anxious and depressed. So are we going to add more anxiety and depression to our stakeholders, patients or staff, as healthcare leaders? Or do we have a better strategy managing these both parts? In terms of patient care, have we thought of approaching them in a psychologically executed way to make sure they feel that they are safe with the healthcare offerings that we have in our facilities? When it comes to staff, unpaid leaves, leaves without pay, are these leaves being justifiably allocated? Let's say healthcare is not an industry where usually people get leaves at all. I mean, this is my personal experience in my 11 years. It's extremely difficult to allot leaves to staff, especially nurses, doctors. So we are always being very skeptic about that decision making in terms of balancing the roster and to understand whether in the flow or in the ICU, in the wards, in the different departments within the healthcare setup, have we allocated enough staff? What is our contingency in case if one staff is down? Let's say they are getting infections, or they are being subjected to any kind of illness, or do they have any emergency situation? So what is our backup plan? So this is exactly how the healthcare industry runs. It's always having challenges which you need to sort out as the operation goes by, right? So right now, given the crisis situation in today's environment, if we try to assess the leadership's capability by the number of patients or by the number of occupied beds or how many staff at work or how many cases have been attended, do you really think that it will help us in the long run as a healthcare leader? Let's say we have to take a call on this. How are these indexes considerate enough for us to make a decision, or our approach should be more strategic? In my opinion, if you can interact with me much better. So yes, Mr. Robert.
Yeah, hi. I think when you mentioned strategic, I think that would be a clue. So I think it's in terms of leaders, you need to see the long term. I think what these are interesting metrics, the number of patients, but what is that? Is that in any given day, your occupancy rate? You know, that's just a reflection of where you are at the moment, not where you're going to be.
100%.
And how many staff at work? Again, that can fluctuate. You build that into your staffing plan. Generally
Yes.
speaking, you would have 16% of your FTE would be
Yes.
factored in. So, and cases attended. These are sort of day-to-day operational metrics. I
Yes.
think you need to look further down the line.
Exactly. We should be futuristic because we might save some amount understanding the number of patients. Okay, I will slice my operation and then I will prioritize the volume of patients. Okay, and then for the time being, we will breathe and we will survive. But what about the coming months? Are we going to look at a futuristic achievement? Because this is, as you rightly said, this is just day-to-day operational uh, engagement, I would say, or index or metrics. These are not the KPIs in a crisis situation. The more you understand that emotional intelligence should be overpowering the reactions, then we will be having a win-win situation. Okay, so now let's move on to our next slide. What is a crisis in healthcare? Crisis can be a pandemic, and crisis will not always be a pandemic as well. So here I have a quote from a visionary leader. A leader is one who knows the way, goes the way, and shows the way. So are you able to tell me some recent or historical data about healthcare crisis situations we experience globally? Anybody can tell about the crisis that healthcare underwent? Can anybody raise your hand, please?
Corona was the main,
Yes. Corona was a huge crisis. Yes, I agree. What about the rest? Any other crisis like Corona? Yes, Mr. Tarindu?
Ma'am, what about the flooding crisis in USA?
Yes, absolutely. Anybody else? Let's take few examples, okay? Since Mr. I'm sorry, I can't remember your name, who mentioned about the crisis situation emerged in COVID. COVID started, I believe, in China, if we are not wrong, right? And then it was a pandemic. It was a global crisis which equally attacked the whole world. Am I correct in saying that?
yes.
Yes.
Okay. So when it comes to this crisis, what happened? Hospitals were overwhelmed, right? Because we did not know what COVID was. It's a new virus. And then what is the death rate? What is the possibility of a cure? What is the immediate solution? How to get tested, like all this swabbing and all? It took some time for the healthcare system to get adapted to the disease itself, right? So hospitals were, as I told you, overwhelmed, and leaders were sometimes in some health facilities backing up, thinking that they will get this is a contagious disease, so this will affect their health. And then sometimes the staff were not willing to come to work, and then sometimes the staff got already infected and they were also becoming patients more than healthcare task force. And this happened globally. Like I've been in UAE when this happened, and how much of things we could control in this crisis in terms of COVID. If we had known about the COVID and its behavior when it started in China, if the information was not restricted but publicly announced. So when I'm saying this, I have to be very careful because this is a global broadcast of information. So there are restrictions when, let's say for an example, UAE right now, UAE has a bomb, for an example, but UAE cannot announce it to the whole crowd saying that in Dubai at this time there will be a bomb, right? Because people will start panicking. So there are certain regulations and there are certain restrictions and levels being implemented in information broadcasting. But had we known the exact ideology behind COVID better, The healthcare systems of all countries must have act accordingly. But then again, we did act accordingly eventually, right? So ICU triad decisions, rapid ICU expansions worldwide, national lockdown, and then transforming on-site medicine to digital medicine, home care platforms. Elderly populations were given special attention because of the nature of the virus. And then in India, they started delivering oxygen via railway resources because there was a big oxygen shortage. As such, crises are actually a learning curve for healthcare leaders like us. Don't get me wrong, I'm not going to be like brutal that crisis should happen in order for us to learn, but COVID was a huge learning curve because it was a very, very chaotic pandemic situation, whereas majority of the countries in the world went to a lockdown. Then, as a contingency, the healthcare leaders got together with the help of WHO to implement services, to implement PPEs, to implement safety protocols, to introduce vaccinations against COVID in order for us to get ready for outbreaks and to mitigate it and to avoid such circumstances in the future. Okay? Am I correct in saying that?
Yes, correct.
Okay. So when it comes to Ebola, it was very recent, right? What happened in Ebola virus outbreak? Can anybody tell me? What was the country which got the most yes, Mr. Mohammed?
Regarding Ebola virus, it was mostly impacted the countries of Africa.
100%. But then, by the learnings and the experience we had with COVID, I think we executed Ebola much, much, much better. Do you agree with me?
Yes, I agree.
Health education was much prominent than COVID, and the information system, the social media, the digital media, the printed media, everyone started educational broadcasting across the globe, even though it started in Africa, right? And then we could mitigate the contingency rate because of the patient education. Okay, so let's take another crisis. USA recently faced a huge crisis, right? Being flooded. Am I correct? So it was like, who thought that America will be flooded? I mean, I never thought. I never in my entire life thought that America will have a flood, to be honest with all of you. But it did happen, right? What was the action points that America took to mitigate the effects of that crisis? Can anybody tell me?
You'll have to. I'm not aware of. Maybe I've just been off the news slightly. So, is this a recent event, or is this? Are you referring to the Oklahoma floods, Hurricane Catherine?
The Catherine, yes, the Catherine. That's what I'm referring to. So Catherine was destroying a very big portion of USA, and actually we were trying to contact with our stakeholders over there because we are partnered with some USA amenities for the healthcare executions. So as per the information received, they immediately started. Yes, Mr. Tarindu?
Ma'am, as we think, like, for example, Sri Lanka, India, Pakistan, Bangladesh, like Asian countries, we do get floods. So we used to this one. So we know what to do in the initial stage. as per my thought, like America didn't, go through that one well in the first stage because they never thought it will affect them.
I agree. I agree with you very much, because Asian countries having flood is like countries like Lebanon or Sudan are having wars. This is like, don't get me wrong, it's like something we are accustomed to, right? So we were having, yes, Mr. Robert.
Yeah, just again, the criticisms of that response, and I think it's clear throughout
Yes.
history. There's a little bit of healthcare colonialism. Those countries
Yes.
who have the healthcare spend tend to do better.
Yes.
Those countries that don't tend to do worse. There
Exactly.
was a lot of criticism leveled at the federal response to that flood, mainly because
100%.
it was in poor parts of regions, majority black communities. So there was
Yes.
a lot of criticism leveled at the federal response and even the state response.
Exactly. As healthcare leaders, is that the right approach? In my opinion, it is not, because doesn't matter if it is an underdeveloped country, developed country, or developing country. System should be accessible for every citizen without ups and downs. So that's how healthcare leadership in the future should be shaped. So sudden operation disruptions, shortages, supply chain breakdowns, financial instabilities, trust issues, these are daily crises that a healthcare organization or a healthcare facility or a clinic or any other amenity is going through on a regular basis. But when it comes to crisis response, it talks a lot, and it talks a lot louder about who we are. This is my perception about crisis management, because the better we absorb the facts and the better we give emotional intelligently sorted resolutions are way better than making decisions impulsively, or not absorbing the decisions, or being recklessly, aggressive or repulsive or reactive to the situations. I believe attentiveness in a crisis is making a healthcare leader become better. So this is my thought about it. So now, since we explore few examples about the crisis, I can give you more examples, like the Gaza war, where they were not having enough infrastructure. The whole world got together to make sure that they have enough infrastructure in terms of health to be able to serve the nation. And then in China, there was another situation of having again this heavy what do you call this one, execution of infrastructure in terms of resources, machineries, devices, and all these kind of things to be able to send to other countries and to be utilized. So these are like very recent examples. So let's say right now we are in the middle of the war, but are our companies, like let's say the company that I work or the company that you work, are we understanding this crisis with the essence of emotional intelligence, or are we accepting this crisis in the mode of reaction? Apologies, Mr. Talha. I just increased the volume. Am I audible now?
Yeah, I can hear you very well.
Okay, perfect. So back to the question I asked. In this crisis we are facing right now as healthcare leaders, please let me know your thoughts. Are we being reactive, or are we being attentive to this crisis moment in most of the healthcare facilities or within your organizations?
For me, I think if you're talking about can anybody be less than reactive to the current president of the United States, then I would like to meet them because I don't think anybody can have a strategy going forward when politicians are all over the place. They're vacillating between one thing and the other. So I think you have to have a crisis response scenario.
Yes.
We are now, I think, 4 or 5 weeks into this,
Yes.
and we're continuing, but we're starting to move to ensuring where is our supply chain coming from. What happens should the peace talks fail, the ceasefire breaks down. These are questions that you can ask yourself proactively and
Yes.
have plans in place for scenario A, B, C. That for me is basically good business continuity planning and good risk analysis.
Perfect. This is the exact answer I was expecting, Mr. Robert. I'm so grateful. The the more you know about the situation, situational awareness is a key for us to make proper decisions. As you rightly said, we cannot be like 100% strategic and being non responsive or non reactive to the scenario, but because it's a non-controllable event that we are going through right now. But always, if we have the contingency plans for our aiming business continuity, and to make sure that the resources are being rightly allocated and the operations are being timely executed, that's all we can do right now, because we cannot plan for like next quarter or next year, or right what we are doing usually in management meetings, because this is case to case basis, day to day analysis, until and unless the global leaders will give us a proper plan. Okay, from this day onwards everything will be fine, or on this day onwards nothing will be fine. So we have to take one day at a time. But when we are taking one day at a time, if we don't have a backup plan, if we don't have a contingency plan, if we don't have risk analysis metrics, if we don't have any idea about what's happening, we suffer, our staff suffer, simultaneously our stakeholders, the patients, suffer. So right now we have covered the essence of crisis in this slide. Now, let's move on to the next slide. I think you can see my slides, right? So we already discussed about the crisis examples: epidemics, cybersecurity attacks, wars, outbreaks, scarcity of supplies, non-informed ad hoc attacks in terms of health, and leadership becomes visible in uncertainty. And what are the things that we can do to make sure that the demands which are unpredictable are met, how to have contingency plans, how to assess the situations, and how to become aware about the crisis, and to strategically act with emotional intelligence. So now in this slide, since these two slides are like interconnected, this one and this one, I would like to just emphasize on one fact. Leadership is the capacity to translate vision into reality. The more we plan, the more we sit in management meetings or shareholder meetings, the more we discuss, yes, we will have some strategies and we will come up with some visions. But how are we going to action it? How are we going to practically execute it? That is the reality. So in this context, since we covered the examples and the crisis topic, I think now all of us are in a better understanding about what I am referring to. So keeping this in mind, I would like to go to our next slide. So a leader is the one who turns vision into action and obstacle into opportunities. Just like we discussed a while ago, the leaders are the ones who has to take visionary objectives collectively and execute it. So how better we can execute such visions is the question here. As Mr. Robert rightly said in our previous discussion, okay, we have ABC in front of us. How are we going to let the teams or let the healthcare ecosystems get adapt to this ABCD and action them? Let's say, for an example, COVID-19 curfew was a very big obstacle, right? People were unable to come to hospital facilities. Just like that, right now, in the mid of the war, Miss Aziz, can we please have your mic mute? Thank you very much. So, in this time at the war that we are experiencing, our biggest obstacle is that we are prefer to stay out indoors, not coming out, right? So in the first 2 weeks of March, you might have seen on the roads barely anybody was outside. Doesn't matter whether you're sick, you're not sick, you need to do any aesthetic treatments, wellness treatments, you need to do lab tests. Doesn't matter what was the necessity in terms of healthcare, everyone was stuck indoors because of the circumstances of the current situation. So, how can we transform that obstacle into an opportunity? During the time of COVID, we came up with mobile medical services. We came up with digital consultations. We came up with pharmacies delivering the medicines to the doorstep. Then we came up with things like on-call services. We came up with things like healthcare education online. So many things changed from the printed era, from the digital era. Then we also explored the social media tools to make sure that the medical professionals are meeting the normal community online. So that is an obstacle which became an opportunity, right? Similarly, right now we are in the middle of the war. So again, people are being restricted and mobility has been, very limited. So we can similarly come up with strategic approaches to bring healthcare to their doorstep. So now, but here it's different than COVID. When we had COVID, we had task forces who had PPEs to protect themselves, do the infectious diseases screenings, go to patients' houses, do the swabbing, and then determine if they have COVID or not, and then execute the treatments as it is. Right now, we have people who are not even willing to go to patients' houses or to engage in mobile services because it's a war, it's a different situation. But then again, as healthcare systems, we can strategically execute things. Like, for an example, we can still do the online consultation. People are still in the need of certain medical necessities. So we can address all those necessities in a transformed way where such obstacles are being turned into opportunities. Am I correct in saying that? Do we have any other ideas where we can, discuss better? Yes, Mr. Amar?
No, you're absolutely right. I mean, the home service and pharmacy home delivery, all of these things can be activated. And also keep in mind that all hospitals under the, I'm talking about Abu Dhabi, under the umbrella of Department of Health,
Yes.
are also having their contingency plans and readiness to support and help in case of any
Injuries.
incident or anything happen in Abu Dhabi, and they are keep regularly reporting their capacity and their availability of beds to accommodate any patients.
Injuries or collateral damages, right?
That's right.
Yeah. So this is how healthcare leaders should act, because we cannot say, okay, it's in Dubai, it will not affect Abu Dhabi. Okay, now it's in Abu Dhabi, it will not affect Dubai. Anything can happen because we are in a crisis situation. I really appreciate your input, Mr. Amar. So the better we know, the better we are prepared, the better we can act in terms of human factor and in terms of organizational factor, because organizations have objectives and people needs care. So this two has to get combined. So sometimes, I mean, in my capacity of experience and work, sometimes not only the external crisis, we are facing internal crisis and obstacles as well. Sometimes medical staffs are not cooperating or not ready or not willing to execute or extend their services. So always we have to take all these internal and external factors in terms of acting according to the reality. This is what I wanted to add to what Mr. Amer rightly said. So now, uh, again, now we know that there is a crisis. We know that we need to turn visions into actions, and we know that there is a big room for the obstacles to be opportunities. I'm not being sarcastic here. It's not that okay, obstacles should come. Let's say, for an example, Dubai was flooded 2 weeks ago, and I cannot say that oh, this is a good obstacle, so I will have more sick patients in the coming weeks. This is not what I'm trying to imply. What I'm trying to imply is if there is an obstacle, as healthcare visionary leaders, we can make that as an opportunity, not to make advantages of our circumstances or patients, but to ethically address this, whereas we can make that as an opportunity to obtain or acquire organizational goals. I think I'm clear till now. So let's move to our next slide. So this is a very interesting session. I need all of you to answer me this question. Since we came this far, what is your biggest challenge right now as a healthcare leader? Is it managing patient expectation or cost or team burnout, supply, operations, decision making, management pressure, or wrong decisions or budgets, or all of the above? Sorry, can anybody, can we all interact, please?
What
Yes,
none of the above? What if it's none of the above?
yes, okay, thank you,
Yeah,
Mr. Amber.
all of those are really important areas, and it's really considered as a big challenge. Where I was referring to sometimes that the regulations or the change in regulation is might be a big challenge where it's difficult to implement in your healthcare facility for some reasons. Either
Yes.
it's the facility itself, whether it's for example, giving you an example that recently, not much recent, like 5 years back onward, they have started the new standards to comply with the civil defense requirement, where there was a lot of centers have built or established their healthcare facilities in residential villas or flat, where it was very challengeable to comply with. I know it's for the sake of patient safety, but also it was a big challenge to a lot of facilities. Not only that, when we talk about health insurance and the factor calculation, also there was a big challenge where a lot of healthcare companies were impacted in their profit.
Yes. Anybody else? Thank you, Mr. Amber. Anybody else? Please, Mr. Nilesh, you were raising your hand, right?
Actually, I don't have idea. I'm from oil industry, but I think all of these can be challenges. But my daughter is doctor, just for your information.
Okay.
He is doing master in India. So
Well, congratulations to her. Thank you so much.
thank you. So That's what, but I don't have any experience regarding hospitalization. I think I can answer about oil industry.
Thank you, Mr. Naresh. How about you, Mr. Tarindu?
Well, I'm not specifically from medical industry. I'm from aviation industry, but I can relate to these things. I can say all of the above, but the main thing I can say poor operation planning and poor decision making, along with poor management pressure.
I hear you loud and clear. Anybody else? Anybody else? We have 53 participants here. Can anybody please talk? Yes.
If you allow me again,
Yes,
Doctor,
Mr. Amar.
I think, yeah, all are apply, and I believe that you have rightly sorted them in a right order. Patients' expectation nowadays is a big challenge with the big competition in the market. Um, the technology that's being used, and there is a lot of services and luxury services, I can say, is being offered by the healthcare facilities. So meeting the patient expectation now became a big challenge for the healthcare companies.
Yes.
The patient and user now having a lot of options in front of him, and easily he can quit one facility and go to another facility for very simple reason. Unless
Yes.
the quality, definitely the quality of the healthcare services is continue as an essential, but also considering the quality of the healthcare services are meeting the standards, patients are at a big risk of quitting and moving to another facilities.
100%, Mr. Amar. So, as you all very correctly mentioned, the answer is all of the above. Let's just touch these points because I know all of you are very much aware. Uh, so, in terms of patient expectations, Mr. Amar was actually million% right. Patients' expectations from before have been shifted from a medical perspective to an AI perspective right now, if I am saying it the right way. AI is a very, very good thing where you can use to research about things, but AI is not a dependable tool to live. But unfortunately, patient expectations, not only because of AI, it has been influenced because of a lot of factors. As you rightly mentioned, the market, the market is overcrowded with lots of different healthcare offerings. So right now we are not even healthcare anymore. Healthcare is being heavily commercialized, I would say. So the patient expectations are all over the place. They do not know if they want to follow AI, if they want to follow Google. I don't know if you have heard this term before. We used to call in the healthcare industry, oh my God, this patient is having Google doctor. This was a term that we use internally. Now it has shifted from Google doctor to ChatGPT doctor. So patient expectation in terms of pricing, positioning, quality, everything has been shifted with the current trends. So that's question number one. You wouldn't even believe me. I received a call from one of our branch managers that patient is asking, do you have any war discounts? This is how the mentality of the patients have been shifted from medical oriented to commercial orientations. Now, second thing, cost pressure. One clinic is offering, let's say, ABC treatments for 100 dirhams, whereas 100 other amenities are offering it for 55 dirham, 60 dirham, 70 dirham, 80 dirham, 90 dirham. So the metrics of quality is being overpowered with the cost pressure. Next is team burnout. We are all commercialized, especially, I'm sorry to say this, but this is a fact. UAE has become a health commercial hub, given the fact that it's a very good thing if you do it in the right way, but it's a very, very bad thing by doing it in the wrong way. Why I'm saying that? Teams are also being pushed for not medical or not health recommendations, especially the medical staff. They've been given targets, they've been given pressure to sell, not to recommend, which I personally disagree, because a patient's trust is not something you can play with. Yes, I agree that you have to meet the organizational expectations, but in the right way. So teams are being burned out because of this sales pressure. Then supply. Of course, the demand of the services have been arisen. So the supply demands have already simultaneously being accelerated. Then daily operations, what to do, what not to do on a daily basis in a healthcare industry. Mr. Nilesh is not like in oil industry. So like we have daily patient to case to case basis challenges. Why I'm saying that to Mr. Nilesh is that because he rightly mentioned in oil industry there is a set of rules and regulation. You go by the book, or you have some practical adjustments in the oil industry where you can still find the right and wrong between things. But when it comes to healthcare industry, since it's a very time to time evolving and time to time changing industry, daily operation decision making itself is a challenge. Now, this challenge is influenced by decision making. Let's say, for an example, right now, the patient volumes of the hospitals, let's say it's a wellness center, have dropped by 50%. Okay, so the management is being pressured and management is being panicked, and there is a wrong decision or a right decision being made. I'll give you a very practical example. I need all of you to tell me whether this is right or wrong. So now the number of patients have reduced from, let's say, 20 to 10, which is a 50% drop. Okay, hospital, the healthcare entities are being, what do you call this one? Identified in three different ways. Yes, Mr. Rama, like prestigious clinics, moderate, and low end. Let's take this as an example. Allow me a second, Mr. Amar. So if we are to take a decision about the volume of the patient, do you think it's the right decision of the management in the prestigious clinic to say that, oh my God, we are running out of patients, now we should start giving it for, let's say, 50% discount? Is this a strategic move? Yes, Mr. Amar?
Oh, sorry, I raised my hand because your voice was breaking, but I believe it was the problem of connection from my side. Sorry, actually, unfortunately, I didn't hear the question and the case that you presented well. I'll leave
Okay.
it to my colleagues to respond.
Let me rephrase it. So there is A, B, and C clinic. A is, let's say, concentrated on expat market. Okay. B, they are concerned about moderate and rich market. C, they are concentrated or they are catering the high network individuals. Okay, and we are in the middle of the war, and the patient footfall for all A, B, and C entities are 50% down. Okay, now clinic C or the healthcare entity C is taking a decision that, okay, since I don't have patients, I will give 50% discount for all patients. Or patient A, which is catering the working crowds, are taking a decision, okay, we will give 50% discount to all our clients. Which entity made the right decision as per your perception, with all due respect?
For me, I think the first question, to give 50% discount on the C category, which is the high-end network.
Okay, I'll give you another fact. So now who are the people who is left in Dubai and who are the people who are not available in Dubai or Abu Dhabi?
Rich people left Dubai, high end.
High network individual have already left Dubai, right?
That is the only assumption. We don't know, but we heard on the Instagram or something.
It is
Maybe,
not,
yeah.
your assumption is a fact. It's correct.
Yeah.
Half of the high network individuals have already left. So doesn't matter if you give 50%, 60%, 70%, or you give the treatment for free, they are not here to avail your treatments. So for as Mr. Amar rightly said, if category A, who is catering working crowds like us, who are already in Dubai, started giving discount, it makes a perfect sense for their patient strategy to increase the footfall, because they are the ones who are staying in Dubai. So if the niche market, the high end network market that we are targeting, if they are not here, doesn't matter whichever the service you offer, they are not willing to take it because they are not physically available in UAE. So if we are the health leader in A, B, or C, we have to first understand who my clientele is, who my audience is, not rationally making decisions. Okay, well, this panicking, I don't have patience, I should give discounts. So this is what I was trying to give you an example. Everything should be assessed as per your organizational reaches, as per your organizational culture, as per your organizational patient contents or the audience, and as per the treatments or the healthcare offerings you lead. So this is a very, very a factual example I wanted to bring up to. When it comes to making wrong moves, let's say for an example, I have few high network individuals who are staying in Dubai already and I'm giving them 50% discount. Now, looking at the future, when the high network individuals already hopefully return to Dubai, these people will still ask for the 50% discount, whereas money was not an objection for them in the first place. But since you have bombarded them with this 50% discount, there is a tendency that they will come and ask for the same, even though that is not the right market to give such a allowance, I would say. Please correct me if I'm wrong. So these are the two approaches I wanted to take as an example. Okay, well, now our first question Q&A session is done. Do you want to grab any snack, drink some water while we are talking so I can move to the next slide? We can move, right? I hope
Yes,
all
we
are
can.
with me. Okay, perfect. Now, let me go to the next slide. Now we are trying to understand the part 2, which how to lead this reality. So there is a saying from Miss Brain Brown. I don't know if you have heard about her. She's a TED Talks speaker, as well as she's the chair of a very known university in USA, and a chair of the Healthcare Foundation. She's saying brave leaders are never silent around hard things. So right now we are in a hard thing, right? What do you think that she meant? Sometimes, I'm just giving you a funny example, guys. Sometimes in your management teams, you will find people, anything and everything the owner says, yes, sir, okay, sir, will do, sir, absolutely, sir, not a problem, sir. Even if he says that, okay, now since the war is there, let's close this company down. Okay, sir, sure, let's go home altogether. There are managers who thinks themselves of managers, or there are leaders who thinks that they are leaders, who is surviving in the company by saying yes, 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 yes. So according to the knowledge and the experience and the exposure that I have, this is not at all the right practice. If the manager is saying, if the owner of the company is saying that this is uh, this should be shut down, you have to have the ability to assess the facts and say, sir, with all due respect, this is the prospected forecasted volume, this is what we have reached till today, this is the projected volume that we will be achieving by the end of this month or this quarter or year, and based on that we have reached or not reached the break even point, then we can take a call on it, not the yes, 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 yes mentality. If you know what I'm trying to say, because I worked in organizations whereas this yes mentality have, put the organizations to disruption. Sorry to say, it's very funny, it's very simple, but then again, no excuse, because it's just not leadership. It's just that you are saying something for the sake of saying to keep your job, but not acting as a leader. If you know the facts, if you know your risk, if you have evaluation, if you know your contingency, if you have a plan to execute, why are you just being a robot and say yes, 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 yes? We don't have to do that. So according to my advice or my opinion, first, as a healthcare leader, to act on the reality, we have to understand the risk that is posing based on any of the circumstances on the organization. So maybe it's war, maybe it's COVID, maybe it's floods. We have to understand how is our supply chain. We have to understand how is our financial forecast. We have to understand how is our human resource factor. And we have to understand the behavior of the patients. So as long as we understand these things, we are prepared. A manager or a boss who is not prepared for anything coming or hitting them in the eyes in the future, I'm sorry, we cannot call them as a leader. Not in healthcare industry, not in any industry. A leader should have the ability to mitigate such risks and carry the organization to the next level. This is what means by a visionary leader. It can be a healthcare leader, it can be a oil and gas industry leader, it can be an aviation leader, it can be a food and beverage industry leader. Whoever it is, as long as you don't know the risks or as long as you're clueless about what is happening around you, you wouldn't execute a good plan or you wouldn't even think of a preparedness, right? As long as you are prepared, do you need to go and say yes, 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 yes to each and every meeting? I don't think so. You have the facts, you have the plan, you have the presentation. Then it's up to the management to based on to take a decision, a right one based on your emotional intelligence and the facts that you have presented, or to still go ahead and shut it down. Am I correct, guys? I mean, do I make any sense? Perfect. Do you have any questions or do you have any other ideas that you need to add to this context? Yes, Mr. Robert.
No, I just agree with you. I think those organizations that have that culture embedded in them are inherently unhealthy. I think if you know the story of the Emperor's New Clothes, it's akin to that. So where people are just frightened to speak up in fear that they look stupid or they don't know the
Yes.
answer. And I think that is a really unhealthy culture to have in any organization. And you're quite right to say that ultimately the organization will be at risk.
Yes, organization will be at risk, Mr. Robert. And I personally know an organization, a healthcare entity, which went bankrupt because whatever the, like, let's say for an example, my company owner should not be having me if what all he says is right. Am I correct in saying that? Because
Correct.
I
Both
am
sides.
exactly. Let's say, for an example, a marketing manager in my organization. If I can take decision on behalf of my marketing manager, I should be doing that. I don't need him. That's why I said respecting the ideas of people is an essential culture that we need to foster, especially in healthcare industry. And I kindly invite all of you, all 52 people that who are engaged in this conversation, let's take that message as a high priority. If you think that if you open your mouth and speak, you are in trouble, that means you are not in the right place. I'm sorry to say, because your opinion matters. As a healthcare leader, what you know about your operation, can anybody know better than you about your role? I'm not saying that you have to always be arrogant and argue and fight. But what I'm trying to tell you is you have to speak the right thing at the right time with actual facts. Now, I'll give you another example. Let's say I disagree with the owner of my company. I'm going and sitting in the management meeting and saying, Mr. ABC, I'm sorry, I disagree with you. The company is profiting, so we have to keep it open. But I don't have any numbers, I don't have any reports, I don't have the plan of the resource allocation, I don't have the sales execution plan, I don't have the budget forecast, I don't have the expenditure, I don't have the P&L in front of me. So without facts we can't argue. That's why if you know the risk, if you evaluate the risk, if you have the risk in your hand, and if you have the preparedness for that contingency, trust me, always you will prove your point and people will respect you for that. This is a weapon that all of us as leaders, especially young and energetic leaders, should foster in your organizations. I think it's essential right now globally to take this message to our organizations. So hats off, Mr. Robert. Okay, I'm going to the next slide now. It's about emotional mastery. So now we were talking about all these things and we have come to a point where we can understand what exactly does this mean. Okay. In times of crisis, if you can read my slide, in times of crisis and global disruption as of today, 82% of healthcare leaders report increased operational pressure because of rising costs, supply disruptions, workforce instability, and continue to challenge healthcare systems globally. So this is what I was emphasizing on the previous slide, that as healthcare leaders, I understand we are just 52 people sitting in front of each other trying to understand healthcare leadership role in realistic times and to try to make a difference. So we have to start this bottom up, not top to bottom. We cannot call any global president or global leader and say, hey, hello, your leadership model is not correct. I learned in Bradford International that this is how the leadership should be. Can you please implement that? We cannot do that, right? So we have to start from ourselves, within our mini organizations, within our corporate sections, within our communities, within our outreach. Because leadership is the emotional mastery. What does this mean? I was talking to you about emotional decision making in our previous slides when we start talking about it. Emotional intelligence decision making and emotional decision making is two different things. Can anybody tell me what is the difference as per your understanding?
Yeah, I will just give you lighter note. When we go to shop, my wife like it. There is no logic, so emotional decision.
Mhm.
But I politely refuse it by giving logical answer. That is emotional intelligence. That you don't need it. You have a lot of things. Now what you will do? You don't have space. So
Exactly.
Great example in
So,
the weekend, Nilesh.
yes, Mr. Amar.
I was
Thank you,
saying that
Mr.
it's a
Nilesh.
good example in the weekend. I think he experienced it just yesterday.
yeah, everybody experiencing who is married, I think.
Thank you very much, Mr. Nilesh. So, emotional decision making can be emotional decision making, and emotional intelligent decision making. So, as you gave a very practical example, I think all of us professionals can understand what exactly does it mean. Now, I'm going to be a little tricky here. My business has dropped from 30%, or let's say 50%, let's say 30%, not 50%. Now I have to take a decision on my resource allocation in terms of staff planning, because since I'm not occupied as I used to be before, let's say compared to 2025 April, May or June, I don't think so the situation will turn better overnight. So now I have to take a decision about my resource allocation. If I am an emotional healthcare leader, how I will take that decision? Or if I am an emotional intelligently mastered decision maker, how I will take that? Can anybody tell me what are your inputs on this? Shall we all speak with each other, please?
Are you
Mr.
referring
Amar,
to your,
please.
are you referring to your resources in terms of your human resources for a decision such as
Yes,
that?
I'm referring to human resources. Yes.
So emotional decisions that you would make there would be if you know that somebody is the only sole wage earner, you might spare them. If you know a bit more about somebody's background, you might make emotional decisions about who to let go or who to put on unpaid leave. I
Yeah.
think an emotionally intelligent decision would be to have a town hall, tell the staff where you are, the decisions that you have to make. For me, I would be asking for volunteers first, and then take it from there.
Perfect. What about you, Mr. Amar? You were raising your hand.
Yeah, I do agree with Mr. Robert. The same thing. First, we will seek for volunteering. Um, um, I mean, contribution, if I can say, or
Yes.
then if again if the volunteering wouldn't work, then the communication is essential here. We need to rightly and transparently communicate with the staff, explain them the situation, provide them some data, which gives a logic where this is the right decision at this time. Especially that healthcare facilities, in healthcare facilities, the manpower cost is the highest cost in the organization. So the first management decision in such a crisis is going to the reducing the manpower cost. So emotionally intelligent decision is, I think, the right thing. How to communicate with your team, explain them the situation, asking for volunteering for reducing the cost of the manpower, then wait for the feedback of the staff.
100% agree. Mr. Robert, Mr. Amar, thank you so much for adding value to this session. I'm greatly appreciating that. You are absolutely right. It should be emotionally guided, intelligent decision. Not that, oh, I am close to them, okay, I don't know how to get rid of the, oh my god, mentality, or no, I cannot afford to this, you must go mentality. Either one of the mentalities will not work. As you rightly said, we know our staff KPIs better than anybody, because we are in the operation, we are in the ground operations, we are with them most of the time. Especially in the healthcare industry, you are always hands on, so you know who is doing what. So as you rightly mentioned, we can assess the volunteering percentages, who can understand, okay, I am volunteering, I can go on unpaid leaves for such a specific days. So if you want me back in the operation, I am flexible. Okay, you agree, then you take that decision, that call. Then again, if you are to get rid of people, if it comes to that kind of a situation, unpaid leaves or the LWPs are no longer viable, if you need to get rid of staff, kind of a very rational top management decision, then you have to sit with your staff, assess your staff's KPIs. Getting rid of people who are the best performers is a mistake than getting rid of the low performers. But then again, crisis situation is not the right moment to tell them that, oh, because you don't perform, we will get rid of you. It also should be well communicated. You should have proper facts in front of them for you to come to a mutual understanding between yourself and your staff. So this decision making will be very guided and very mutual, and it will not create conflicts between the management staff and the regular staff. So let's take that into a very important point out of today's webinar. Now, I'm going to the next slide. Can all of you see there's a triangle moving in my slide?
Yes.
What does that mean?
I don't know.
So, yes, Mr. Muhammad.
I think it basically means that this is a good order of how to respond to a crisis.
Thank you very much, Mr. Mohammed. So this triangle is the triangle of leadership in healthcare crisis management. Okay. So since we started our training, we were talking about three main focuses. Okay. First thing is you are working for an organization or you own an organization as a healthcare leader. So you should definitely know what your organization goals are in terms of profits and sustainability. That's number one. Number two, you should know your patient. Just like, in the banks, they do KYC. In healthcare industry, we should have KYP, because we should know our patients' requirements in an ethical approach. So this is where the practice ethics come to play. Then the next thing is, how are we delivering? How are we resourcing the patient care? So these are three critical points in healthcare leadership in terms of crisis management. This is called the triangle of healthcare leadership. So that's why I kept the triangle moving on, so then it will go to your memory. So what are your thoughts about this? Can we really prioritize only one, or should all these three things be considered at the same time and we have to make quick and simultaneous decisions? I think the best, yes, Mr. Amar?
Altogether.
Altogether, because in a triangle you cannot select which point is the best, right? So it is a simultaneous decision making. You should obviously prioritize your organization goal in terms of profit and sustainability. Make sure that the conflicts matters are being resolved then and there. And then, for an example, rising cost was pricing pressure, discounts or value, or operational efficiency, care versus cost, ethics versus revenue. I don't want to go deep in detail into this one, because we already discussed all these matters in our previous slides when we are interacting with each other. So responding to a crisis as a leader plays a huge role, and you should take all these three main action points into a huge consideration. Know your resources to allocate in patient care, know your patient in terms of ethical approach, and know your organizational in terms of profits and sustainability of that profits of the organization. So if you don't mind, I'm going to go to the next slide now. Now, this is actually a research-based graph that I'm showing you. This is as per the latest healthcare leadership trends. Most preferred leadership qualities among staffs, or let's say if we do a survey within the healthcare stakeholders, this is, you can see my circle here, right? This is what they have answered. So what is the biggest portion? They're like, it's for empathetic leaders, where the leaders can understand their team, inspire the team, being honest and transparent with team, leads with heart, and lift one another. Inspiring only have only 10% here. Decisive is 10%. Adaptive is 10% as well. The rest are for the reliable leaders. What does this mean? Can anybody give your inputs? Here, this one. So that means our since we are talking more about healthcare industry and the leadership in healthcare management, this circle shows a lot that we are silently experiencing. You have to first be an empathetic leader with a reliability of yourself, where your people can rely on you, and then have inspiration, decisiveness, and adaptability in the same amount. Yes, please, Mr. Amar.
Yeah, may I ask, this survey happened where some staff were asked to perform a survey, which what do you want your leader to be more focused, right?
Yes, yes, correct.
My concept here, when we talk about the 45% went to empathetic, right?
Yes, correct.
So, actually, I don't know whether we will blindly follow what are what we can see in terms of the surveys, or we need really to think of what make the staff vote for empathic more than other inspiring or decisive or adaptive or what any other part. Taking a practical example, for example, if during the last year I was asked for a leave, but my leader hasn't accepted it, I would say that my leader wants to improve that part. Okay, but maybe that rejection came because of operational reason. Like,
Yes.
I didn't agree because another person in the same department is going for leave.
Yes.
So what I'm trying to say that we shouldn't look at surveys and blindly follow and improve our things without knowing the other point of view. So we shouldn't always be in the position of the staff and improve our in changing our quality or leadership just because what we get. Sometimes, or not sometimes, all the time, we need to do a root cause and deep analysis for that surveys and understand whether that survey gives the realistic data that it really helped me to improve the organization.
100% agreed. So let me explain you what is this data depiction is. Okay, so this is just a survey, as I told you before, whereas right now in this circumstantial situation, people prefer to work with empathetic leaders, maybe influenced by the emotional factor or the emotional intelligence decision making that we previously discussed in the previous slide. because people are already mentally drained. So when we are acting, you rightly said, your manager could not provide you leaves because another person was already availed at that time, and he cannot afford to have two operational leaders being on leave at the same time because it will impact the operation. So let's take it in the other way. Let's say a staff comes to me, and or you are going to your manager, and he is not trying to explain you, Mr. Amar, yes, I can accommodate your leave within this due, maybe due to this particular reason. I hope for your kind understanding. Or maybe we can give you in this due instead of this request of yours, so we can adjust and we can operationally optimize the plan. If that is not the case, and if the manager is just saying, I'm sorry, I cannot give you leaves. So these make two different approaches. So this is what I'm trying to say. A leader who is empathetic, meaning the leader cannot always, like the monkey story. I learned this last week actually. Uh, the, the staff is coming up with so many problems in their shoulder. Empathetic leader, being an empathetic leader doesn't mean that you can take all those burden in your shoulder and you drain by yourself. You empathetic leader means that you don't boss around. You will have to have an approach to your employee like your manager did to you, Mr. Amar, that uh, he gave the fact that this is the reason behind I cannot afford to lose you at this time of the operation. So this is all what the employees are referring to. Sometimes employees are not 100% right, but sometimes they are not 100% wrong either. So we have to find a middle ground. This graph shows the survey data during this time right now. Actually, this started before because Ramadan came early this year than any other year. So these survey data are very, very, very recent, which is like very current data. So they like to appreciate empathetic leaders or to accept and acknowledge reliable leaders, whereas the leader has to inspire them, be decisive and adaptive as well. Not that leader has to go down and accept everything that they say because they have empathy. So it has to be an emotional intelligence decision in terms of showing empathy towards staff. Did I answer your question, Ms. Amar?
Yeah, sure. That's why 45% only. So he
Yes.
was accepting 55% of the requests, and 45% was rejecting. Oh, just
Exactly.
kidding.
Thank
Okay.
you very much. So, okay, now since we have a better understanding about this, let's move on to our next part. Now it's a real-time scenario. A patient is demanding a discount treatment during supply shortage. Uh, as healthcare leader, because now we are trying to understand how to act as a leader in a crisis time, will you reduce the quality, or will you absorb the cost, or will you refuse to provide the service? What would you do? Can anybody tell me, please? This is our second question and answer slide. Yes, Ms. Amar?
It depends on the profit margin that I have for the service. If the margin allows me to provide some discount, I would do, especially with such scenario where I don't have much number of patients and I need to grab the patients from everywhere as much
Yes.
as I can. So I would definitely not reduce the quality, because that will impact the uh, the
Trust?
the the trust and the reputation. I wouldn't. I would. Okay, I may check if the cost of the service can be reduced by the supplier. I would definitely say yes if they give me discount from the supplier. I may not refuse the service at all. Yes. So I would agree with the discount, maybe. I'll try first with the supplier whether he can reduce his cost on the organization, so I can maybe give that to my client and win him as a client.
Excellent. What about others? Can anybody please answer? Yes, Mr. Harvey.
Yes, hi.
Hi,
My name is Muhammad.
Mr.
I
Mohammed. Go ahead,
Yeah,
please.
thank you. I would rather take all options.
Okay.
I will look into optimizing the solutions, make
Mm-hmm.
it more efficient, which
Yes.
means keep keep the quality
Yes.
at the same range. Maybe reduce the efficiency a bit just
Mm-hmm.
to uh, cap with the situation.
Okay.
And also the quality. I will have to be more stringent. I
100%.
yeah, being the same at the same level of the previous situation or what my customers was used to have as service from me is not an efficient way. It's not a business
Oriented.
continuity plan. Yeah, it's not a
Yes.
business oriented or business continuity plan. I will always have to have a business a plan B, which
Mm-hmm.
is basically reduction. We cannot hide it. It's
Yes.
either reduction in quality or in cost.
Yes. Okay.
Yeah.
Can we hear from others? Thank you very much, Mr. Mohammed. Can we hear from others as well, please? Anybody? Mr. Mohammed, Mr. Robert, Mr. Tarindo. Anybody, please?
Yeah, I think it's quite a generic scenario. I think as Mr. Rammer was saying at the start, it really depends on the type of treatment that this patient is demanding a discount on. They won't know if it's a supply shortage. Maybe they have that information. Maybe they're looking to leverage their information to demand
Yes.
a discount. But you know, it really depends. Is this a procedure or a treatment that you do 400 a week? So discounting one isn't going to really impact on your business model. Or is this a really sort of high risk, high return treatment? So it really depends. But I would sit down and I would ask them
So,
why they're asking for a discount, what their level of discount is, and then
yes.
we'd start the conversation there. In terms of healthcare, I would never look to reduce quality in healthcare. Because
Yes.
I think that just impacts patient outcome, and that is a sort of false way to go, because you impact patient outcomes, you end up with longer length of stay, and then you end up in a whole scenario where that's you end up with your insurance payer not paying, you end up with hospital acquired infection, and you end up losing money hand over fist if you drop your quality thresholds.
Thank you very much, Mr. Robert. So if I may answer the question, can I say this is a case-to-case basis, a decision that the healthcare manager has to take without reducing the quality, but absorbing the cost, without refusing the service, but to adjust as per the patient demand or the request, as long as it will not be a loss for the organization. Am I correct in saying that?
Yeah, sounds a reasonable position.
Yes. So being futuristic, as you say, maybe we cannot go more down the line, or maybe the discount that the patient is asking is not quite reasonable, so you can give your answers based on the quality that you have already provided to that client in the history with the historical data and facts, and make sure the patient understand the limitations of the discount that we can afford to give, and then definitely not to dilute the quality, because we are looking at a futuristic investment, even though right now we will slightly lose on the discount. So thank you very much for everyone for answering. Now, then this is the actual answer for the previous slides that we already discussed. So Leading through a crisis is more than managing unusual events. Plan for different situations. Communication with all stakeholders is important. Be proactive rather than reactive. Look at the crisis as an opportunity to learn, grow, and transform. I think we already covered this point in the previous slide. Yes, Mr. Mohammed. You have raised your hand. Anything to add, Mr. Mohammed?
Sorry, it kept raised.
No problem, not a problem at all. So since we already had the Q&A and we summarize all the main scopes of the discussion, so I think this is the summary of the whole thing that we discussed in the two previous slides. So let me go to the next one. Crisis is a make or break moment. What leaders don't actually talk about, right? We feel burnt out, we feel emotional fatigue, our staffs feel pressure to perform or fear of wrong decisions that we already discussed. So allow me to add a very valid point here. Burnout doesn't always look like falling apart. It looks like overachieving while you quietly erode inside. What does that mean? What does that it means is, in my 11 years of experience, I have seen leaders who are enslaving themselves, especially in the moments of crisis. But this is not a right practice. Yes, I agree you should help and you should simultaneously work hard alongside with your staff, but it doesn't mean that you have to be absorbent of all the things in the world and falling apart inside quietly. So burnout is a subject that is very much popular and everybody is talking right now, because I think this is a suggestion from my side to all the healthcare leaders. Some entities may or may not have people to help other staff to have like ombudsman sessions, I would say, to have one-to-one discussions about what their operational challenges really are, or to console them, or to have them counseled. This is a lacking part I see in the industries. When I'm going to do trainings on many healthcare organizations, especially hospitals and clinics, I have not seen them having at least a dedicated person, or if you don't want to afford for a department, at least a contact or an outsourced way of handling the burnout of the staff, especially because this can eventually lead to the organizational collapse, because staffs will quietly be demotivated, especially given the times of crisis. They are working but they are not being appreciated. They have they have problems, their families are pressuring them because they are in the war zone. Their families might be in any other zones like flood zones and all. But then again, at the end of the day, what are we doing for the staff welfare? Or as healthcare leaders, how are we taking care of ourselves and our teams? This is something that we don't usually talk at a time of crisis. So I want to emphasize on this matter before we end the session, because I feel and I trust and I believe that it's a very essential part in any organization. Let it be healthcare, let it be oil and gas, let it be aviation. We all are struggling when it comes to a crisis, because especially global crises are impacting all our mental and physical health. We keep going because we need a job, we need to act like a leader, we need to show them that we are strong. Doesn't mean that we ourselves are 100% okay. So I think as we are talking about healthcare leadership, we should consider implementing mental health of employees and ourselves. Yes, Mr. Mohammed.
Basically, I have a question regarding this point.
Yes, please.
Does it have to be specifically related to crisis, or it could be general things?
It could be general things. What I'm emphasizing is, especially in terms of crisis, when we lack this part generally, it will affect more in terms of the situations of crisis. This is what
True.
I'm trying to explain.
True. Because
Because
genuinely, this is something that is really needed in the healthcare facility. So, in the idea that we should not let one be impacted whilst the other ones simply get along with whatever is going on.
exactly, we also have to have a non-bias mod or a person or a resource where
Yep.
we can reach out to in terms of overcoming the burnout. It
Mm-hmm.
should be 100% non-biased. This is very important. Also, let's say you have a HR. Every company has a HR department, right? So you
Yes.
think, oh my god, oh, I'm feeling so depressed, I will talk to HR. If the HR is not the right person, who has an education of psychiatry management, or who doesn't have a background of taking others or to counsel others, then our burnout will be double. Because
Yep.
what we expect, or what our teams expect, is to have a consolation. Instead, we will have doubled our pressure when we walk out of that person's cabin, or after disconnecting the call with that particular person. So I think as healthcare leaders, even though we don't pay much attention to this specific scenario, as you
Mm-hmm.
rightly said, Mr. Mohammed, keep the crisis aside. On a daily basis, we are in operational battle with each and every patient. It
Mm-hmm.
can be a doctor, it can be a nurse, it can be an attendant, it can be a housekeeping staff who continuously rubs the floor. It can be my accountant who continuously check the billings of the patient. It can be my insurance billing person who's overwhelmed with the insurance request. It can be myself who is trying to manage all these stakeholders without falling apart. So all of us need this help. Even though we are not paying much attention to burnout at work, I think it is an initiative that, as healthcare leaders, for us to initiate in our organizational levels, because I find it important.
Thank you.
Thank you, Mr. Mohammed. So let's now take it as a key takeaway point, and then let's go to the last part of our conversation. So, as we discuss all these things, decision making under pressure has to be always driven by emotional intelligence, and we don't need to take decisions based on reactions, but we always have to be proactive. Yes, Mr. Robert.
Yeah, hi. Just before you move on, I just to give everybody a heads up, I shared a link on the chat. It's just as you
Yes,
were talking about psychological safety.
yes,
There's during times of crisis, there's what we call psychological first aid, but then the more wraparound care is something that we call code lavender. Now, in the
yes,
healthcare industry, we're very good at doing code blue, code white, code red.
yes.
So for those who are interested, there is a sort of code lavender policy procedure, and it's something that would benefit every organization. So I've just to let people know that I've shared a link to some article that might pique somebody's interest.
Wow, fantastic, Mr. Robert. Thank you very much. We all are very grateful for that. Thanks a lot. So, Code Lavender is what I was trying to tell you about. With or without crisis, we should have in our go-to in our day-to-day operations. Which, thank you so much for the link. We all can refer to that link after our session is done. So I think we can find a better, as you rightly said, Mr. Robert, we call all other codes except this one. So crisis management is not only the environment crisis, it's crisis management internally, emotionally, and mentally. So I think we can take that point out of this discussion as well. So decision making under pressure was what I was referring to. Now we all know that decisions cannot be impulsive or reactive. It should be it should be proactive and emotional intelligence, doesn't matter what is the norm of pressure. So we have to take the clarity to take perfect or close to perfect decisions as a responsible leader. We do not do decisions based on incomplete information or high consequences. We always have to assess it and make difficult decisions based on emotional intelligence to protect our teams, protect organizational reputation, serve the best to our clients because they are with us in the future. They were with us before and they are now with us presently, going through the same things that we are all going through. And stay accountable and lead with empathy. So this is what I was trying to emphasize on this slide, that sometimes you make the right decisions, but sometimes you make the decisions right. I hope all of us can understand what I'm trying to say based on the facts that I have discussed overall since we started the webinar. So that's all about it. Now let's just summarize. Leadership should be a balanced approach. Crises always have to be amplified, and amplification is a critical factor to analyze the risks and the opportunities and the visions and actions in a crisis situation. Ethics are our foundation to take healthcare decision making. Sustainability right now is almost as equal as survival, but sustainability doesn't mean that you agree to anything and everything. It should be factual, it should be driven with emotional intelligence, and we should be courageous leaders in order for us to drive our teams to success in the midst of crisis situations. So, leadership is not about being the best, it's all about making others better, as we discussed throughout this session. I hope everything is clear up to now. So, what kind of a leader I am in a crisis situation is a self reflection that I have put as the last slide. Am I a reactive leader? Am I a defensive leader? Am I a decisive and an ethical leader? Or am I all of the above? Or I don't give anything about this. I am none of the above. So this is something that we need to think as healthcare leaders, especially in this time, to make sure tomorrow or day after tomorrow when we go back to our work, what kind of a leader I will be, what kind of a leadership that uh, uh, I will execute, what kind of a leadership strategy I will present my staff with, what kind of a leadership guideline that I will present my top management or the ownership of the company will be. This is a decision that we have to make because it was a very informative and a very constructive session, I believe. I think most of you will agree with me. And this is actually what I want you to self-reflect on, to understand and practically apply what all we discussed throughout this hour and a half, so we can make our leadership qualities better and we can be an example to the other leaders in our organization, and we can start implementing the learned subjects and execute it practically from bottom to top. So then our organization will be better. One day our cooperative entity will be better. And then one day this region will be better, country will be better, and we can create a global impact by being a right leader at the right time. Do you agree? Thank you very much. So now, I have some videos that I have linked to this discussion. I think Bradford will share the links with you after we finish the webinar. I can also share the presentation with all of you so you can, go through and self-reflect
Yes,
on the
ma'am.
things. Right?
Yes, ma'am.
can
We
do
will
that,
be
yeah?
sharing this. Yeah, this lecture is being recorded. and it will be put on YouTube for everyone to go through it again.
Thank you
Mhm.
very much. Thanks a lot. So I just took few very impactful videos which we don't have time to play right now, but you can at your leisure time. I kindly invite all of you to refer to, because you can learn from each and every person, each and every perspective, and we have to adopt those modules for our day-to-day healthcare operation to make ourselves better and to make our healthcare ecosystems better. So that is
Ma'am,
for
you can
your
share the links if you want. If you want, you can share the links of these videos in the chat.
I will check if I can share on the same. If not, I will share it on the chat by the end of the session. I have to take it from the presentation.
Okay.
Okay.
We can share it afterwards then.
Okay, thank you very much for the participation, and I really appreciate it. To be very honest, I enjoyed it a lot. So I really want you to self-reflect, because behind every treatment, there's a decision. Behind every such decision, it's you, the leaders, who are carrying the responsibility. And in times like this, when uncertainty is constant, we are not just managing healthcare, we are shaping the trust, dignity, and the human lives. So let us choose who we want to be as leaders tomorrow onwards or tonight onwards, and let's make others better by being the best version of healthcare leader we can be. Thank you very much. Do you
Thank
have
you
any
so
questions
much.
for me?
Sorry, go ahead.
If you don't have any questions, we can wind up. I hope everyone enjoyed the session. Thank you so much for your time. I really appreciate it. And I enjoyed it. Thank you so much, Bradford team. You did a brilliant job. Thank you so much for all the help. And I wish you all a wonderful evening if you don't have any other questions for me.
Thank you.
Thank you very much, Mr. Nilesh, Mr. Robert, Mr. Amar, Mr. Mohammed 1, Mr. Mohammed 2. Thank you so much for everyone. It was very enjoyable. Thanks a lot, and have a safe and great evening. Take care of yourselves.
Thank you so much, Dr. Jamali, for such an insightful and thought-provoking session. Your perspectives on balancing patient care, profit, ethics, they have truly given us a deeper understanding of what effective healthcare leadership actually looks like. And a big thank you to all of our attendees for joining us and being a part of this session. We hope you found it valuable and inspiring, and we do look forward to seeing you in our upcoming sessions. Thank you.
Thank you, Sakshi. Thank you, everyone.